Deficiency disorders. Iron deficiency. Anemia is the most frequently encountered biological symptom in human pathology. Universally observed, 30% of the population suffers from anemia. In Algeria, 44 to 55% of pregnant women suffer from vitamin deficiency anemia. Physiological reminder of the red blood cells. Erythrocytes equals red blood cells. Lifespan equals approximate 120 days. Red blood cells fix oxygen in tissues thanks to the iron contained in hemoglobin, their red pigment. The RBC's sole function is to carry hemoglobin, which itself transports oxygen from the lungs to the tissues. Carries 20% of carbon dioxide. What's important for the body is oxygen transport capacity, and therefore hemoglobin concentration in the blood. Where do red blood cells come from? CFU-GEMM is a cell type that is a precursor of the myeloid lineage. CFU-GEMM stands for colony-forming unit and GEMM for granulocyte, erythrocyte, monocyte and megakaryocyte. Erythropoiesis. The production of red blood cells in the red bone marrow from pluripotent hematopoietic stem cells, under the influence of erythropoietin, EPO. Reticulocytes are red blood cells newly formed by the bone marrow. They still contain ribosomal RNA, which distinguishes them from mature red blood cells and makes them difficult to identify. The respiratory count is a key parameter for assessing the proper functioning of erythropoiesis. It is mainly used to determine the mechanism, central or peripheral, of normo or macrocytic anemia. Hemoglobin. Hemoglobin production occurs in the early stages of erythropoiesis, from the proerythroblast to the respiratory stage in the bone marrow. HB is a member of the globin superfamily. Hemoglobin is a tetramer composed of 4 chains called globins. 2 alpha chains, 141 amino acid. 2 beta chains, 146 amino acid. Definition of anemia. Anemia is defined as a decrease in hemoglobin levels. Definition therefore varies according to the patient's age or sex. Anemia if hemoglobin less than 13 grams per deciliter in men. Anemia if hemoglobin less than 12 grams per deciliter in women. Anemia if hemoglobin less than 14 grams per deciliter in newborns. Anemia if hemoglobin less than 10.5 grams per deciliter in pregnant women. Anemia is not defined by a decrease in red blood cells count or hematocrit. Definition of deficiency anemia. Decrease in hemoglobin levels secondary to the unavailability of exogenous factors required for erythropoiesis, essentially, iron, vitamin B12, folic acid, folates. Iron deficiency anemia, or iron deficiency anemia, is caused by the depletion of iron reserves, resulting in a reduction in the amount of iron required for hemoglobinosynthesis. Hepcidin is a peptide hormone secreted by the liver which regulates the body's iron metabolism at the level of intestinal absorption and hepatic storage. It has been shown to be a key hormonal peptide in iron metabolism, capable of inhibiting intestinal absorption of dietary iron. An iron-rich diet results in increased production of hepcidin, which in turn reduces the absorption of excess iron. Pathophysiology of iron deficiency. Anemia occurs when there is a break in the closed circuit of iron metabolism. Causes of iron deficiency. Causes of the breakdown of the closed circuit of iron metabolism. Physiological increase in needs not compensated for by diet, pregnancy, growth, lactation. Intestinal iron malabsorption, chronic diarrhea. Celiac disease. Excessive iron losses, chronic hemorrhage, any loss of RBC through bleeding results in a loss of iron. Main cause of iron deficiency anemia due to minor bleeding, main causes of bleeding, gynecological cause, digestive cause, upper or lower, Bleeding varies according to age and gender. Regulated equals gynecological cause, men and menopausal women equals digestive cause. Biological consequences of iron deficiency. Semi-latent deficiency, tissue iron deficiency, increased transferonemia, excessive production of transport molecules to carry the maximum amount of iron to user cells, increased transferrin receptors in user cells and circulation, soluble transferrin receptor STFR, increase in erythrocyte protoporphyrin, low CS, high CTFT. Prelatent deficiency, depletion of reserves, decrease in ferritin and then serum iron. Finally, patent deficiency, anemia with decreased MCHT, DGM, HB. Microcytic anemia. Microcytosis and abnormal hemoglobin synthesis. GMV less than 80 indicates impaired hemoglobin synthesis. The defect in HB synthesis induces an increase in the number of mitoses. The RBC attempts to maintain correct HB saturation, equals CCMH. Treatment. Treatment of Marshall deficiency is based on two principles. Correct the deficiency by administering medicated iron. Restore iron reserves in the liver. Treating the cause of the anemia.